There we go. Okay. So any questions about last week? You guys are good. You seem to know it all already. All right. Well, what I'm going to do then is I'm going to turn it over to Chad. He's going to start us off tonight. And then you get to hear from Todd and Brian as well. So you get the whole gamut tonight. All right, Chad, all you.
You start sharing your screen and everything changes. Can you all see my screen?
Yes.
Thank you very much. I appreciate that. Get this where I can see y'all again. I don't know why it does that, but so we're going to dive in and talk. This evening's going to be about theories and motivational interviewing. There we go. So which factor of these do you think most influences the way humans behave? This is interacting, so y'all can unmute and just talk into the room and let's have a conversation.
Attitude?
Attitude.
I would say culture. Yeah,
Culture.
race and culture.
Race and culture. So there's really no wrong answer here. It all depends on the person and the experience that they have growing up through life. It just, one area may impact more or less than another area on their behavior and their scope of health. So it's just everybody's uniquely different. How's that? So what drives, the health behavior to change? If we need to understand the people's life choices around their health behavior. You need to consider the factors that impact them personally. They're impacting by their environment, and then there's other outside influences as well. As a health coach, each of the clients they will present a unique challenge in trying to help them be successful. To a coach, you're trying to help them to be successful, and it's going to be unique in doing so. Just keep in mind that it's not a cookie cutter type style treatment. Everybody comes at it differently. Everybody's got, race is one thing, attitude is another. Everybody has different elements or factors that impact their lives. Because adopting a healthy lifestyle is complex, numerous models have been developed to explain these factors affecting health behaviors. Many of these models collectively serve as a foundational basis for the field of health coaching. Do you all remember the trans-theoretical model? Yeah? So talk to me about it. What stands out, or what do you remember about this model?
I remember that it includes pre-contemplation, which is the stage before they're even thinking about change. So it takes into consideration like change before change is ever even considered, if you will.
Yep, absolutely. And it also helps us realize, if we know what level the client is in, or what stage the client is in this model, then we know how to better help them. So, for example, like you were talking, Patrick, about the pre-contemplation, is that where we start doing SMART goals? No,
It's not. No.
it is not. So, basically so talking about pre-contemplation, talk to me a little bit more about what you say they're not ready for a change. Does a time frame stick out to you about when or how long they're going to be in this stage per se?
I would like to know. I'm taking the board exam tomorrow.
Tomorrow?
So,
You're taking it tomorrow?
Yeah.
Well, if they're in pre-contemplation, they're not looking to make any change within the next 6 months. It's not in the radar. You start talking about making a change and make it defensive about it. They may have a lack of awareness of needing to make a change. For example, smoking. You know, I like to smoke. Don't care about the impact of it. I like it because it calms me down. It gives me a chance to get out and take a break. You know, and so they're not that client is not ready to make a change in smoking. So it wouldn't even be, you know, hey, you ready to stop smoking? Heck no, it's not. I'm not ready. You know. So as a coach, how do we respond, or what is it that we can do as a coach with the person that is in pre-contemplation? This isn't open to everybody, by the way.
Would you start to explore what they're ready to change and maybe not focus on what they're not ready to change?
What if they're not ready to make a change at all in anything?
Would you talk about their map and try to like attach to that somehow to get them to come around to wanting to change?
You could, yeah, you could that, and with the PHI, you could bring the PHI in and just start, you know, having a conversation around, you know, you give yourself a number here, you know, what does this mean to you? What does that look like? And just see where they are with things. But in doing all this, you're holding the space for them. You're listening, you're actively listening, you're present, you're not judgmental. What's the other one I'm thinking about? This allows you to build that rapport, that trust with them, because you're not pushing them to make a change. You're just present there, listening to them, and having a conversation. Maybe if you can, you know, invite them to talk about the PHI, you know. But that's where you start. Is you just meet them where they are. We're not ready to make a change yet. They're not ready to make a change yet. So that's where we start. What about contemplation? What is
At that
contemplate?
point, yeah.
Go ahead.
So, I'm sorry. Yeah, I think at that point you're talking to them about what they need to do. You're brainstorming together. You're talking about the next step. What would you do to make a change? And how do you want to go about it? Where do you see yourself in the next 2-3 months? You know, stuff like that. You're thinking about it. You're thinking about the change.
Yeah, that's it right there. They're thinking about it. That's the first sign, is in contemplation of, well, maybe smoking is not that good for me. I'm on the fence about it. And so now you can start talking to them about, you know, talk to me about the pros and cons of making that change. You know, the decisional balance tool that we have. Talk about the pros and cons that for not making the change, you know. And then if you need to, you can use the EPE and hey, I know a little bit about this. Would you mind if I share this? And again, they're the pilot or the co-pilot. If they say, no, I don't want to hear it, moving on. But it's that balance of, well, yeah, but I might be able to stop smoking, but I really like it because it gives me time to, you know, to get away from everybody. So they're on that crossroads right now, trying to figure out whether they want to make a change or not. And so being able to maybe identify some strengths and something that supports them may tip them in the balance towards making that change. Again, just having a conversation with them, but you're looking for those strengths and those positives as to, you know, why would you want to make a change? All right, the determination, also known as preparation, is the stage. So I've seen it both ways. Talk to me about preparation.
Having a plan and tools that you need to be successful to carry out that plan.
Yes, having the tools and the plan, having the support, the resources. I got the strategies, I got everything. I'm getting ready. You know, as a client, as a coach for the client, you want to offer that supportive, positive environment. You want to be there. You want to listen to them. You want to identify any potential obstacles. And this is where we start focusing on and setting a SMART goal, creating that, where are we going from here? What's the next step? And creating that action step, that SMART action step. The more specific your plan can be, the more likely the client will be able to take that next step successfully in whatever that action plan is. All right, it's rolling on down to action. Talk to me about that one.
Yeah, now you're ready to go. Take the steps, do the works.
You are doing the work. You are the action. The preparation is done. We've planned for it. Now we are in action. And Patrick, we've been doing we've implemented this change within the last 30 days. Okay. So now we've started. Now we're developing a way to sustain that action, that positive action moving forward. It's important to assess the successes, the obstacles, and the learnings. What went well? What didn't go so well? What'd you learn? You know, being able to create those contingency plans for the new obstacles as they arise. You want to support the self-efficacy of the client the self-efficacy and confidence of the client by regularly reflecting back the strengths and values, linking their values to of change, linking the change to their overall values and their map. Okay. On around to maintenance. What is maintenance?
I think at that point you're evaluating what went well, how to sustain the success and avoid a relapse.
The relapse are going to happen. We'll talk about that one in a second. But in the maintenance, and again, the time frame is you have sustained this behavior change for more than 6 months. Okay, we're doing it. We've done the action. We've been consistently doing it. We've sustained it. We're in this maintenance stage. We're doing it for 6 months or more now. That's where we are. You want to encourage the client to expand their support networks to include others that maintain the same similar habit that they're doing. Again, discussing the potential challenges and the possibility of a relapse, like you said, with the client, and identify the strengths, the tools, and the contingency plans to help cope with the future challenges. So with the relapse, when does a relapse occur, or when could it occur?
Life event, change.
That's what would cause it, but when in this stage, the model here, when could it occur?
Between the action and the determination.
A relapse can happen anywhere in the model, anywhere. And we just need to normalize that with the client and let them know that, hey, stuff's going to happen, life's going to happen, something's going to set us back. And when that happens, we got it. What's your contingency plan? What's your plan B? So when this does happen, you recognize it, and how do we get back on track moving forward again? So the relapse can happen anywhere within the model, and the client can actually enter and exit. He can be in multiple different stages. If he's working on several different things, he may be in pre-contemplation about smoking, but he's in the preparation stage of going to the gym. So he could be in multiple places on the model at the same time as well, depending on what the goals are. So it's a very dynamic model. Any questions about the trans-theoretical model? Covered that pretty good, huh? Awesome. All right, moving on. So while the field of coaching is relatively young, the strategies and techniques used are in fact evidence-based, which essentially means that they've been backed by theory-derived research-based information. In order to be an effective health coach, it is important to understand the notion of health coaching within the theoretical frameworks that have influenced its development. Given that the fields of psychology and adult learning are particularly integral to coaching, we'll provide kind of an overview of the theoretical frameworks here. So before we dive in, I want to take a mindful moment, if that's okay with you all. Cool? All right. So I've got one that I use with some of my clients sometimes, and I'm gonna read it out of this book here for you. So if y'all don't mind, you can just relax, you can lower your gaze, you can close your eyes, you can do whatever, just get comfortable. And I'm gonna read through this. Just give me just a few minutes, okay? All right, so get my glasses on so I can see here. I would like for you to begin noticing your breath. Noticing the sensation of breathing passing through your nostrils. Notice the in breath and then the out breath. The inhalation and the exhalation. Every time you become aware of a distracting thought, noise, or sensation, just notice it and return to noticing your breath. Every time you exhale, let go of any tightness or tension you notice and allow yourself to be more deeply held by the chair. Notice all the places your body is in contact with your chair. And really allow the chair to hold you. Now repeat silently to yourself a simple 3-word phrase over and over again in your mind. As you inhale, say your name. As you exhale, say, let go. If you become distracted, just bring your awareness back to this phrase. Now let the words go, keeping your eyes closed, and just be. Take your time when you are ready. Open your eyes and come back to the room. How was that?
That is something that I want to use with my clients.
You'd like to use it with your clients and be brutally honest. How was it for you all? How did it impact you? Did it help you? Did it do anything? Nothing at all? I'm just curious.
Yeah, I mean, I felt relaxed. I was trying not to fall asleep.
It was working.
It makes me be present in the moment.
Brings you to the moment, being present. Okay.
I think the verbal cue of coming back to your breath or being told to do that is a good reminder, because my mind wanders so easily. And so I'm like not even paying attention to what you're saying anymore in my mind. And then when you give that verbal cue of like, go back to the words or go back to your breath, it's like oh yeah, I didn't even realize my mind was wandering.
I appreciate y'all sharing. Yeah, appreciate that. So, moving forward. Yeah, we just did that. All right, so what is adult learning theory? And so andragogy, I had to look it up so I could say that, pronounce that correctly. Andragogy is a term introduced by Malcolm Knowles, who's a famous adult educator. It describes the science of helping adults learn. It is also a learner-focused method contrasted to pedagogy, which is more of a teacher-focused method. All right. So there's 4 different principles here, according to Knowles, for the adult learning. 1, adults need to be involved in the planning and evaluation of their instruction. They need to be able to experience it, both the good and the bad, so they can know that, hey, this sucks. I don't want to do that. I learned to not do that. I'm going to do this instead. Providing the basis for the learning activities, the experience is. Adults are most interested in learning subjects that have immediate relevance to their job or their personal life. And then finally, adult learning is problem-centered rather than content-oriented. And then there are characteristics that go along with adult learners. You know, adult learners are self-directed. They tend to be autonomous. They're goal-oriented. Upon initiating an activity, adults usually know what they want to attain. The relevance, good Lord, relevance oriented. Adults, they see a reason for doing something. They need to see a reason for doing something, so they'll do it. And it's most ideal for something that is applicable to their lives or values. It's practical for them in their lives, whether it's related to work-related, family responsibilities, or previous education. Experience-oriented. And then finally, the desire to be shown respect. The wealth of experiences adults have to offer should be acknowledged. Basically, the client comes to us for coaching. They have the experience, they have the knowledge. We're there with them to walk that journey with them. They're the pilot, we're the co-pilot. So we acknowledge them. We're not the professional, the one that's in the room that's, going to tell them what to do. We're just going to walk them through the journey and be there right there with them. So all that being said, to better understand these characteristics of adult learning, thinking about yourself as adult learners, how can we as instructors here in this course create the most valuable learning experiences for you as an adult learner in this program? I like to ask questions to see if anybody's listening to me, if I'm just yakking away.
You make the material relevant and practical and experience oriented and goal oriented, and we get to direct ourselves. That's how we will learn with adult learners.
Thank you for summarizing that up. I appreciate that. Spot on. Anybody else? Are we good? An ideal health coaching program is one that considers core principles of adult learning and design. Here you go. You're here. Factors that are of special relevance when it comes to coaching adults include motivation. You know, the client's reason for wanting to change their behaviors in the first place, whether it's intrinsic versus extrinsic. The self-efficacy, the client's belief about their ability to be successful. And then there's situational factors as well. Life happens, stuff's going to happen that will impact whether you're here or not tonight. You're learning. So what do you think was one of the biggest perceived barriers adults face in relation to achieving healthy lifestyle goals?
Time.
Time.
I mean, really, all of these could be barriers, except for none of the above, because it really could be all of the above, you know, lack of time, not having the resources, the education, or, you know, not having health insurance to be able to access some of those, you know, things that are accessible or not accessible.
Absolutely. This goes back to the beginning. Everybody is different. Everybody's going to have a different perceived barrier. I don't have the time to go to the gym. I don't have the education to be able to go out and be a doctor. That's a barrier. So being able to increase your client's level of engagement in healthy lifestyle behaviors and overall desire to achieve their healthy lifestyle goals can be one of the biggest challenges you'll face as a health coach. The cool thing is I don't have to know the answer to how to fix the barrier. The client knows that. You just got to ask them. More often than not, this requires removing barriers to adult learning. Unlike children and teenagers, adults, you all, have responsibilities that misbalance against the demands of learning. Many of these situational factors can present barriers to motivation and influence clients' level and self-efficacy levels, confidence levels. And then in order to successfully collaborate with adult clients in engaging healthy lifestyle behaviors and ultimately achieving healthy lifestyle goals, health coaches must work with them to develop effective behavior modification strategies. Here are some strategies. Respect the knowledge and experience and understanding that they genuinely know what to do. I know what to do, I just don't do it. I need to get off the fence. Go do it. I just don't have the time. Identifying what motivates them. You know, finding out their values, their map, their purpose in life. Acknowledging the barriers that they may face. Again, you don't have to know the answer to how to fix it. You're just acknowledging it and then asking them the question, well, how do you navigate the barrier and still accomplish your goal? Let them answer that. Create realistic goals for them. Start small, baby steps. Let them be successful at it. Let them learn from it. And if they set a goal that we know that there's no way in Hades that they're going to be able to accomplish that, we're not going to challenge them. We're just going to, you know, okay, you said you want to do it 7 days a week. 2 weeks later, when they come back and see you, 7 days a week. What went well? Well, I did it, but I didn't do it 7 days a week. So what'd you learn? Well, 7 days a week wasn't realistic. And then we start the process over, fine tuning that goal for them, making it more realistic for them. Supporting small changes by continuously providing positive reinforcement, as doing so can lead to big gains. When coaches are trying to change behaviors or old practices, they should apply both positive and negative reinforcement. And then finally, when clients are working toward healthy lifestyle goals, offering appropriate levels of feedback about their success can be highly motivating. Any questions what we've covered thus far? Thank you for participating with me. I think Todd's going to jump in here as soon as I stop sharing my screen.
And while I'm sharing my screen, I got a question for everybody. What do porcupines say when they kiss? Ouch. Oh, I'm hilarious. All right. Everybody sees that okay? We're going to go ahead and we're going to be talking about coaching theories. And what we got here and what we're going to talk about tonight, positive psychology. A little bit of a newer theory in the realm of theories. Then we got that appreciative inquiry. We're going to go over social cognitive theory, social determination theory, patient activation and engagement molds. And we'll sprinkle some other stuff in there. But, when we talk about each of these, we're going to also discuss a little bit how to integrate and apply them into health coaching. And there's some other theories out there, that you may have heard mentioned in class prior, like growth mindset, emotional intelligence. We're not really going to dive too deep into those tonight, but it is something that we should be aware about, these theories and these concepts, as they apply to health and wellness coaching. And we're going to put it all together. And as the slide says, we're starting with that positive psychology. And just a quick review of the theory, and positive psychology, it fits right into that coaching wheelhouse. It's a study of strengths and virtues that really enable individuals, and even you take it out a step, communities to flourish and thrive. And as I said, the study of this positive psychology, it's really in its early stages, and it involves a wide variety of techniques that encourage people to identify and further develop their own positive emotions, experience their character traits. It's really about helping people bring out those personal strengths, focus on those positive emotions. Neuroscience change tells us that emotions drive change, and this is one of the ways that we can really move this forward. And it's as demonstrated value as a resource to help improving that creativity in our clients, help them gear a little more strategic thinking, and that resiliency and connecting things back to their health. And, it can help us in health coaching as health coaches to better prepare for sessions, help us frame things right and ask the right questions and listen to our clients. And it gives us some useful tools to really help our clients succeed in reaching their goals. And this is just a reference, for diving deeper in some of these psychology or theories as they relate to coaching. This is a available manual, that coaching psychology manual. It's broken down 12 chapters, and it's got the skills, breaks down skills and compassion and how, really to help that self-efficacy that we're trying to build in our clients and generate movement as they go forward. And, in positive psychology, it's just research into the emotions, strengths, processes, conditions, and relationships that foster optimal functioning and flourishing in people. And that's what we're all about as coaches, fostering that optimal functioning and allowing our clients to flourish. And it works in both people, groups, institution. And when I said it was young, it's way younger than I am. It was launched in the late 1990s. And it's really a way to counterbalance that intense research and focus on the psychopathological and of things. It's not really a what's the problem focus. It's more, what's going right focus. Glass half empty, glass half full kind of thing is the way I look at it. It emphasizes what is good. And it really involves, a variety of techniques that develop that positive emotions. It focuses on personal strengths. It's really complementary to traditional psychology. And it can help us as health coaches just really, really lean into our client with our clients' strengths as we go forward. And that's a simple definition. I like succinct. Positive psychology. It's a scientific study of what makes life most worth living. And if we take that out a bit further, it's a scientific approach to studying human thoughts, feelings, and behavior with a focus, just as we do as coaches, a focus on strengths instead of weaknesses. Sometimes in coaching, we talk about that perspective shift. We're programmed by culture. We're programmed almost, I think, as human beings, part of survival is to look for the negative, to be our own self-critics. But instead, we're going to switch that. Instead of the weaknesses, we're going to look at the strengths and work on building a good life instead of repairing that bad one. And again, this fits into coaching. Coaching is that present and future focus, where you're at now and where you're going, instead of jumping in the Wayback Machine, looking at all the bad things that happened that got you to where you're at. Really focus on moving forward from where you're at. Take the lives of those average people up to grade instead of focusing just solely on moving those who are struggling up to normal. And it's a really big shift from that traditional medical model that's really just designed to get people to neutral, just to cure the symptoms or of something and treat symptoms. This is really about allowing people to flourish. And as coaches, all those skills that we use, the rapport building and, holding space for people, it generates that positivity, fostering the capacity, resources, and process that are needed for that successful change. And as coaches, we don't diagnose or point out things. We help clients identify things that make them flourish. We guide. Coaching is that non-prescriptive approach. And that's building from, Fredrickson's top 10 positive emotions. And, we look at inspiration, hope, pride, interest, love, awe, amusement, joy, gratitude, serenity now. And we look at those emotions, and positive psychology really allows us to build on them. And by building on them, one of our goal, what happens is another driving force of change is that intrinsic motivation coming from within. That motivation for change then comes from within people. And when it comes from within, they're more likely to be successful. All right, quick poll. Somebody can throw it in the room. Which of the following is not one of the 3 pillars of positive psychology? Not.
Positive institution.
Well, we go back, and institutions was one of them that I mentioned earlier. I don't remember where exactly, but we're looking for positive traits, positive institutions and building on those positive experiences that they have. Positive development is not one of the three pillars, because that's be something like what we're trying to instill in the client, but we're already looking at what the client already has within with positive psychology. And that field of positive psychology, you know, it studies what helps people thrive and flourish. It examines what helps people. It natures those strengths, bringing out the best in people. And that's coaching 101, you know, that strength-based approach. And the three main pillars are just what we went over, those positive experiences. You know, when we're coaching somebody, we look back for maybe the prior successes. They're taking on a new challenge. We look for, did they have success in some other areas? Maybe they've had success with this in the past. Those positive traits, those inner strengths, those characteristics that somebody has within them to help build that. And that positive institution, you know, it examines the strengths that help us cultivate better communities, such as parenting, leadership, tolerance. And, you know, just as coaches, this is really right in our wheelhouse, you know, by helping these people explore these, we help them move forward. And the client's not always going to come out and just straight out tell us what their strengths are. And they may not even initially, you know, at the beginning, recognize what their strengths are, you know, or be able to identify some positive experience. But the coach, we listen, other focused listening, we listen to understand, and we're able to highlight them for them in their reflections. And also through our deeper inquiry, our open-ended questions, you know, we're able to really help bring that out of the clients and use this. Which leads me right into and just some examples of the reflections that highlight those pillars of positive psychology. Oh, John, you have a knack for seeing the big picture. Even when it's not very clear to others, you can use this strength. How can you use this strength in your current situation? You got a reflection there and then a follow-up question. Might want to throw a pause in between there, but that's really, you know,
Go get your frisbee.
you're reflecting back to somebody what their strength is, and then you're able to get them to see how they can use it. And Martha, you recognize that writing your dissertation can be a lonely process. You're recognizing something that's going on and then just reflecting back. Where can you get support and encouragement when looking for this? It's just right. It fits right into that mold with that positive psychology. When we talk about this PERMA model, and we're going to get into a little bit, the PERMA model describes the foundation for, and I heard someone say that they're taking the exam tomorrow. This is a good way to look at an exam question too. We want to look for what's the most coachy answer there. And invite you to read the answers and then read the question. And I bet you're able to eliminate a couple of the answers just by looking for coach speak. Someone want to take a stab at this one?
Well-being and flourishing.
Winner, winner. Well, flourishing. Yeah, when you look at that, you know, how to be happy all the time, that's unrealistic. Decreasing negative thoughts, that's not really a strength-focused approach. How to deal with difficult people, you know, if we could That's just a skill set in all in itself. But when you look at that well-being and flourishing, a PERMA model for well-being, the foundation of flourishing, positive emotions. What are some positive emotions that we can latch onto when we're with our clients?
Joy in something they may be talking about.
Yeah, joy, you know, in something that they're talking about. It can be gratitude, inspiration. And then we got that engagement piece. That refers to somebody's ability to be completely absorbed in a task or activity that challenges and stretches us. You know, this boosts our psychological functioning. And sometimes it's referred to flow. Anybody just been in that moment, been in that flow, lost track of time? We really have that laser focus on the task at hand. And then we got relationships. We're very social animals, and we're naturally inclined to want to connect with others. You know, we have a need for love, connection. It's just within us. And we look for meaning, you know, experiencing a sense of well-being requires, and it takes work. It requires intention, effort, and aligning, you know, when we talk about MAP, mission, aspiration, and purpose, aligning that deeper purpose that's bigger than ourselves and know that gives our lives meaning. And that's for every individual to define. But as coaches, we help people to define that. Then we got accomplishments. And when we talk to that, you know, you can talk about accomplishment just simply as achieving a goal, but not all accomplishments are equal. You know, accomplishments that are meaningful to the person are more likely to boost well-being. Something that's meaningful to you. And when we're talking about the positive psychology and the PERMA model, what are some skills or approaches that coaches use that relate to PERMA?
I think with engagement, maybe elicit, provide, elicit.
Elicit, provide, elicit is definitely one of that. It's in that wheelhouse because we're always in that we're eliciting from them what they already know. You know, we may provide a little bit of information, but then we're going to elicit from them again what they take away from it. That keeps the focus on the client and their engagement and what they see as meaningful in something. What other skills and skills approaches, and we can just say qualities of a coach. When we think about skills or qualities of a coach that relate to this positive psychology model.
I think being present with the clients, you're paying attention, you're listening,
Yeah, being
focus.
present, that listening to understand where they're at. And, you know, and that ability, when we listen to understand, we're able to help pull out those strengths, those positive emotions, their engagement, help them to identify their meaning. All those qualities, you know, that we're trying to exhibit as coaches, being mindful, being present, those all relate to this positive psychology model. Go back to sharing. I got to make sure I share the right screen. I got a high-tech setup. No, I just got 3 screens. I'm kidding. It's not that high-tech. And, I'm just gonna, you just take a moment, consider your current situation. And it can be both personally and professionally. And what do you want more of in your life? What do you feel you are? When do you feel you're at your best? What's something that you did last year that you were proud of? Oh, I went too fast. And now, those are just some questions that we can ask a client that follow this positive psychology model. And I invite everybody, as those questions were asked and you were thinking about them, look in yourself, do some self-reflection. What came up in you? How did you feel? What is something you did last year that you were proud of? Just thinking of that, how'd that make you feel? That's positive psychology. When do you feel you're at your best? Think about that. When you feel you're at your best, now think about how you're feeling in this moment. That's positive psychology. And real quick, the goals is positive psychology to positively impact the client's life. This goal is above all others, and all others fall indirectly into this goal. The main goal of coaching is to assist or guide the client to improve their life. And positive psychology just fuels that as a theory. Increase the client's experience of those positive emotions. We get used to feeling the way we feel and things become normal. So feeling bad about yourself can become normal, but by the same way, having, that positive self-regard can also become normal. Identify and develop strengths and unique talents. Everybody's got them. And by building that and working on that, we help the client with their goal setting abilities. And it nurtures a sense of gratitude in the client. It can be gratitude for self. It can be gratitude for little things, but just that shift, that mindset shift. Build that sense of hope. Hope's a very positive emotion, isn't it? Hope for the future, hope, when you got hope, you can see a future. If you can see it, you can get there. And it cultivates just an overall sense of happiness and well-being. Help with those positive relationships. Just as we talked about, those positive relationships. We're social animals. Having those positive relationships is important. And helps them helps them see that glass half full as opposed to half empty. We're going to shift gears a little bit and move into appreciative inquiry. And AI is just that philosophy as an approach for motivating change and enhancing well-being. And that's what coaches do. This one's a little older than positive psychology. It's been around since the late 80s. And it was originally used as a transformational change process, within organizations and groups. But it's been adopted to a variety of uses. And it just acknowledges strengths and imagines possibilities as we move through our problems. And Appreciative inquiry, valuable to coaches because, it uncovers and celebrates what's best and what could be. Can I get someone to read this?
Once man, became conscious of creating images of the future, he became a participant in the process of creating this future. Fred Pollack.
Yeah. Once you can see it, that vision, that's why that vision is so important. Once you have that vision, you become active in helping create it and getting to where you want to be. And here we just got the 5 principles. They're shown as a pyramid with the peak being just that positive actions and that positive outcomes. And that's just a desire for each of us in every day in some way. And these pillars, as you can read them on the slide, they're just tools in a toolbox. They don't have to be applied in this order. And you just basically, you're pulling out what you need in a moment. But we got, that poetic principle, just having that positive attention in the present. A hopeful or positive anticipation of the future. As coaches, positive questions and reflections, really hitting those strengths. And constructional principles, just having those positive interactions with our clients. And really positive energies and emotions, that's one of those things when we get to those values and flirt reflections, those emotional reflections, really seeing it, really being able to tell somebody when you talked about your grandkids, your face lit up, or when you just, when you were reporting on your goal, your eyes had a twinkle on how proud about your success. Problem solving really revolves around, it's an analyst. We provide answers, blame, divide, considers solutions, fix as an expert. Referred, is that problem solving? Is that coaching?
Definitely not.
Definitely not. That's I appreciate, the assertiveness that you spoke that with. And now we got appreciative inquiry. Appreciate what's going well, highlight what's going well. We lead with questions, that deeper inquiry, own, collaborate, paint that picture to get that vision of what can be, and really look for leveraging that positive. Is that coaching? And I'll say just as affirmative, definitely yes. Those are all things that we do as coaches. We appreciate what's going well. We use inquiry. We collaborate with. We paint that picture of the future, and we really lean into those positives with people. And how to use AI or appreciative inquiry when coaching. As you look at this, are these all things that coaches do? Do we create rapport, build rapport with clients? Do we ask open-ended questions? Do we make note of or recognize that there are challenges? Do we have the clients come up with plans and things and state things in their own words? Yeah. Again, appreciative inquiry fits very nicely into coaching. Social cognitive theory. We're just going to take a look at this. Social thinking theory. Social cognitive theory. But you know, when you look at this, it talks about, you know, social cognitive theory. You may hear social learning or self-efficacy theory, but it just suggests that all health behaviors, they're goal driven through anticipation of outcomes. You know, with this theory, there's constant interaction between personal factors, the person's environment, and the behaviors. If you look at that graph on the chart, those arrows are going both ways. And those personal factors, those include, you know, our cognitions or thoughts that allow us to consider the present situation based on our previous experiences and, you know, what we expect the outcomes to be. And just the environment, that's just the social and physical situations where people are where we're at. Behaviors, those are our previous actions. And these are all influenced by, you know, our self-efficacy beliefs and outcome expectations. And when we really take this and we look at it through a health coaching lens, it's important to understand that clients are capable of self-regulating their action, choosing the situations and environments they will positively influence their behaviors. Not all clients do, but clients are capable, and that's part of coaching. And this is, again, that whole thing about we're autonomous, we're in control. As individuals, we're active participants in maintaining our own behaviors, whether those are bad behaviors, good behaviors. We're active participants in maintaining those behaviors. And this cognitive theory explores the importance of observation, imitation, and modeling of one's perceived self-efficacy. And a lot of clients, they're just hesitant. They don't want to change because they don't believe they can create and sustain a new habit. And that's just another way of saying that, you know, their self-efficacy is not high enough to begin the behavioral change. And we can really work with them, you know, using that social learning theory and self-efficacy theory to help them move towards that change. And that's, you know, when we use our other focused listening, some clients, they don't know what their strengths are. We help them identify their strengths. We help them paint that vision, increase that intrinsic motivation to help them move forward. And here we just got another chart, you know, that it's just flowing. Those personal factors, environment, behaviors just flow together. And this is all influenced by the fact that we're active participants in maintaining our own behaviors. And each one of these influences the other. Got a quick case study for you. And you guys can read this. As you're reading that first one, you know, what's important to consider when we're facilitating Carlos's and coming up with a plan for eating healthier and being more active?
That plan still needs to involve him having the community of getting to eat with his coworkers and have those meals with them multiple times a week, but like can that healthy meal be incorporated in that time rather than fast food, so that he's not losing that community?
Yeah, we got to explore that there may be some values conflict in there. Carlos enjoys associating with his friends, and he does that over his lunch break, and he wants to eat healthier. So we have to explore that with him, and he's gonna have to come up with what's gonna work best for him. And what do you think's gonna help him be successful? And I kind of illustrated that. If we help them explore those values, and we show them that, just by recognizing that and helping them see, okay, I value being with my friends and I want to eat healthier, what's going to help them be successful is seeing, yeah, I want both of these. And he can paint a picture, and with that visioning of seeing a way that maybe he can brown bag it, or he's going to come up with a solution to work around that, to bring both those values into balance. That's one of the ways that this social cognitive theory applies in coaching, and we can help our clients move forward. And it's according to social cognitive theory, we learn by, and again, I invite you to read the answers, then read the question. So what do you think is the correct answer to this one? I'm going to go
C.
with D, doing experiments in the lab. C, observing and imitating others in our environment. It falls back on the old monkey see, monkey do theory. That, we're social animals. We're going to observe others and imitate what others do in our environment. And you can look back through your life and probably see instances of that occurring with you. When you were younger in your family, you were imitating other family members. As you grew, you moved into your peer group through school. By middle school, you're probably doing more so imitating what your friends are doing. You get in to a work group and you start, and it's just, that's the social cognitive theory. And it just really boils down to person, environment, behavior, interact dynamically. Zoom, 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 zoom. They're all over the place, and it's observing, modeling, and imitating. And that's one of the things, from my military days, hearing things. When you're a leader, you want to be what right looks like. And that's because people do imitate. And, you're that leader, you're modeling, you be what right looks like. And that's, now I'm going to ask you to consider the following. That's the same slide, isn't it? I should have saw that. They changed the name. It's the same answers too that we came up for Carlos. It's the same answers for Cora. Self-efficacy is defined as, and I'm going to give you a cue. Self-efficacy is belief in self. One's belief in their abilities to successfully complete tasks. It's that self-efficacy, our belief, our faith in ourselves to be able to move forward. Self-efficacy is that belief in self. Why is self-efficacy important in health coaching?
They have to believe they can do it. Whatever they're trying to accomplish.
Yeah. That just, yeah, I can't put it better, Margaret. You got to believe. You have to believe in self. How do you think we encourage self-efficacy in clients?
By motivating them, encouraging them that they can do it. inspiring them.
Motivating, encouraging, as coaches, we even take it a step further than that. If you're sitting in and you're coaching a client, it's you and that client in the room, how many experts are in that room?
2.
2. You're the expert on coaching process and structure and all these skills and techniques. That client's the expert on themselves. And by recognizing that and using our skills as coaches, we help increase that self-efficacy in our clients. A lot of people, just that belief in self, they don't see themselves as even the experts on themselves. But nobody knows me better than I know myself. Don't tell my wife I said that, but nobody knows me better than I know myself. But that is the way that we're able to encourage it. We create that space, that safe space. We're able to help them identify the strengths, paint that picture of their vision, and let them know that they're that expert on themselves. Oh, self-determination theory. We got a lot of theories, don't we? But this is just all about that person's ability to make a choice and manage their own life. I decide what I'm going to be, what I'm going to do. And it suggests, that people, they're motivated to grow and change by 3 inherent universal psychological needs: autonomy, just being the authors of one's own story; competence, feeling effective; and relatedness. And here again, we got that we're social animals, feeling connected to others. So we got autonomy, competence, relatedness. And I like this part. Motivations to change are intrinsic rather than extrinsic. People don't do things because they're told to do things. They do things because they want to do things. And coaches help find the want to. And people feel more motivated to act when they feel what they do will have an effect on the outcome. Engaging in activities for that inherent reward itself plays an important role in this theory. And just our message as coaches, when we're looking at self-determination, feel it, that client's in the driver's seat. They're choosing their own path of wellness. We're passengers. We got a map, but it's not to tell them where to go. It's more so if they take a hard right, we can keep up with them. And we just coach them through the journey of change. And this theory, we look at this self-determination theory. This helps us stay client-centered. to continuously work with that client to build that self-autonomy and work on that intrinsic motivation rather than that rah-rah false motivation. Because intrinsic motivation is where it's at. That comes from within. And really, when we talk about this self-determination, our ability to make choices plays an important role in our psychological health and well-being. Just think for yourselves for a minute. How you feel when you feel in control, when you have input into outcomes, versus maybe a time in your life when you felt you had no say. Plays a very important role in our psychological health and well-being. Autonomy, confidence, relatedness. Equals that self-determination. And again, looking for that intrinsic motivation versus that intrinsic motivation. And another, we're talking about theories and things, but a lot of what we are, it comes from past experiences. And some of my past experiences was with military training. And whenever we saw stuff that was on more on one slide or something, we realized it was pretty important. So when we're getting there and we're rehashing this to get to that intrinsic versus that intrinsic motivation, that self-determination, that client-centered approach, it's a relatively important concept for the coach. Because it's versus, we want intrinsic motivation, which comes from that self-determination. And again, read the answers. And we all, according to the self-determination theory, we all have a need for this one's a little trickier.
A.
I could see where you would say optimal cognitive functioning. But really, when we talk about self-determination, it's that psychological growth that we're after, that relatedness, that connectedness, everything that that confidence, that autonomy, that growth that we're after. And if you look at those other answers, those are kind of like an ideal state that we're moving towards, and we get there through psychological growth. We're wired to grow and change. We want to be able to make our own choices, have control over our own lives. That sense of control. And universal psychological needs include, according to self-determination theory, we're looking for that confidence, that connectedness and that autonomy, the ability to make connected socially, the ability to make our own determinations. Competence, connectedness. Competence is just mastering skills, learning new ones. Connectedness, need for belong and relate to others. And that feeling of control over our actions as we move forward. You know, how can we facilitate self-determination in our clients? Who's in the driver's seat?
The client.
The client, yeah. We follow that client's leads. And you know, it's not unusual for that new client to really think that they're coming to the coach and the coach is going to tell them what to do and how to do it. They expect, you're the professional, just tell me what to do and I'll do it. And you may even get some clients that feel a little uncomfortable when they're given space and freedom to explore what they want. They got choice. But I think you'll quickly see once the client, you know, understands that we're there to partner with them, they feel empowered. They start taking that actions in ways they haven't before. You know, that's one of the things coach can really open doors for creative possibilities for people. What role does intrinsic motivation play?
I mean, it drives the actions that they take or don't take.
Yeah, it's the client's why, that intrinsic motivation. It's driving them from within to make that change. You know, and it can really, that intrinsic motivation, that clear vision, it can really help, you know, to serve as an anchor almost during difficult and challenging times. Intrinsic motivation from within, that strength that we have. I only got 600 more slides to go and 22 more theories. But we'll
Might be
get
a
there.
might be a good time to take a little break if you want.
All right. Well, you're the boss. Tell them how long.
You guys want like a 5-minute break? Sound good? Okay. See you at 35 after.
You didn't get my jokes?
Get your jokes together. Here we go.
Two chats. Well, I'm going to go ahead and go back to sharing my screen and power through the rest of this. And here's another $6 words. Patient activation engagement models. Patient activation engagement models. And the patient activation engagement model, I'm going to give you this one. You can probably guess at it, but it's how to get patients involved in gaining knowledge and skills to better manage their health. Patient activation model and engagement model. We're going to activate their knowledge and skills to help them better engage in managing their health. And this was first described by Judith Hibbert It's a newer concept. You know, my little producer notes don't have what year it came about, but I'm betting it's pretty young too. But it's just about the importance of engaging a patients in their care. You know, if someone's involved in something, they're more likely to be successful. And here's some coaching speak. So they can take an active role, empowering them to make decisions, take charge of changing their behaviors and improving their health. Facilitate those knowledge and skills and confidence in patients to just be actively engaged in their healthcare. Choices are theirs. The behaviors that they take on, they have influence over. And there's 4 levels of this. And a patient goes from passive to knowledgeable, active participant. Passive to knowledgeable to an active participant. We empower that decision making, empower them, give them that autonomy to make their decisions. What do you see the benefits including? And they're looking for all but the following. And again, I invite you, look at the one that probably goes the most against coaching.
B.
B. Yeah, a strict treatment plan that requires complete compliance. You know, that's that prescriptive approach. That's that if you just do what I tell you to do, everything's going to be rainbows and unicorns. And the problem with that is people don't do what they're told, but they do what they want to do. So if we can help activate and engage them, we're going to increase knowledge, the patient's knowledge and skills. It'll improve their experience that they have in healthcare, and it'll lower healthcare costs. And that's simply by, healthier behaviors lead to less health problems. And the early research improves that this model improves the outcomes and patient experience. It's still pretty early, but it's showing real good potential to lower that healthcare cost. Oh. I went one too far. But when we talk about topics that, may come up with their clients related to, patient activation engagement, some of them, some of our clients will come to us with doctor recommended, whether it's lifestyle behaviors, nutrition, you got to get your, 150 minutes of moderate cardio activity a week and this. And, through the patient activation model, that's what we do as coaches, where, we find out what makes them tick, allow them to apply it, that self-autonomy, and work with them. Work with them to make their choices to incorporate some of these recommendations into actual lifestyle behavior changes. Again, it's their choices. Here's another cool theory, strengths theory. And as a social worker, I'm pretty proud of this because I think this is the only theory that social workers have contributed to the realm of theories that are out there. But this one, say straight back to social work. And this is just simply put, people feel and function better if they're using their strengths. And there's a multitude of assessment tools that exist out there to help somebody identify their strengths. One of our big mission as coaches, we help our clients find their own strengths and build on the resources and use them. just through our open inquiry, our reflections, even getting the client to identify. And we really focus on that strengths approach, building on the strengths as they move forward, instead of, looking at that corrective or prescriptive approach to try to correct weaknesses. Building on those strengths, it has that flow, because oftentimes people have strengths in one area that they can readily apply to another area. It just needs to be guided along that process. I think I only got 6 more theories to go through, but health belief model. Health belief model, it's a belief. It just, people are engaged in health behaviors if they perceive threats and they of not engaging in such behaviors, in addition to general pros and cons of adopting health behaviors. And if we look at it, whether we engage in healthy behaviors, it's got a few contingencies around it, those perceived barriers, the degree of which the person feels threatened or worried by the prospect of a health problem. I think back to when I was in my 20s, eating a pound of bacon, a 16-ounce ribeye, French fries, washing it down with 6, 10, 12 beers. I didn't perceive those as issues. We're now much older than that. I may perceive a threat or susceptibility to a condition, a disease like hardening arteries and high blood pressure and different things like that. And then you also got your perception of the severity of the condition. Then we also got to look at the perceived benefits or beliefs about the positive outcomes from engaging in health behaviors. When we look at that, and some of these, again, I alluded to it a little bit, those personal factors, our age, our personality, our socioeconomic status, our ethnicity, our sex. And then we got to, when we look at this, we got to look for those cues of actions, those internal and external. Whether we have physical symptoms. And the more people are reminded of potential health problems, the more likely they are to take action. If it's just with people with things, somebody smokes for 15, 20 years, never have a cough. They wake up and they start waking up every morning and they're coughing out half a lung every morning and all the phlegmy stuff. I got a problem. I'm more likely to take action. And when we talk about this health belief model and we look at it through that coaching lens again, the effective way to do it is one that addresses the individual, the client's specific perceptions about susceptibility, benefits, barriers, and self-efficacy, or one's own belief in one's own abilities. And again, as coaches, we take people through this and we explore things with this. We explore their values with them. We explore their vision with them. We explore barriers with them. Theory of reasoned action and planned behavior, TRA/TPB. Again, we got the little arrows going back and forth, subjective norms, attitudes, self-efficacy. And this theory, it's often used, just to understand and predict determinants of health related behaviors. And the premise behind the theory is the intention to perform health behaviors is really related to the actual performance of the behavior, due largely to rational decision making. Oh, I hit the wrong button again. And a person's, intention to perform a behavior is informed by influence of significant others. That's subjective norms. Basically, it's what a person believes others think about their ability or decision to perform a given behavior. And, attitudes toward the behavior and its outcomes. And it perceives behavioral control, which is that self-efficacy belief. And just from that coaching standpoint, again, when we look at this, just our understanding of the key beliefs, attitudes, social norms, perceived behaviors, control issues the clients hold in relation to specific behaviors, just our understanding can help us as coaches become more intentional in our approach of meeting that client where they're at. And that's the theory of reason, action, planned, and behavior. I lied. There's only 3 more theories. I'm sorry. You guys were probably looking forward to all 62 of them. But this one, what are your takeaways regarding the role of psychological theories and concepts in health coaching? It was a lot. It was didactic. Well, what's your big takeaway? I mean, I threw a lot of theories at you.
I have a question.
Yes, Nicole.
When you were talking about strength theories, you mentioned assessment tools to identify strengths. Is that something that you would potentially send a client to help them identify their own strengths if they're struggling to identify them?
Would I personally use something like that? I'd rather use the coaching skills and techniques. If you're using a personal health inventory,
Okay.
and then you're coaching around them and getting and using the coaching skills to help them identify the strength in the coaching realm, as far as other assessment tools that you use in a practice, anything that falls within the scope of coaching, you could use, just as long as you're not using it as a diagnostic tool, because coaches don't diagnose. But like a
Like
cool
you would
exercise is
recommend.
like the DIA character strengths webpage. That's a cool tool where they go through and they do some self-exploration on their strengths. Any other big takeaways? Let me phrase the question a little differently. We went through 642 theories. When you look at all these theories, how do you view them from a coaching perspective? What do you see? Just as the theories as a group, what are they to you as coaches?
I mean, really what I got out of it is that there's a lot of proof that coaching is effective because you really work on the motivation of the individual to take action that's meaningful and lasting.
Yeah, these theories support the coaching approach. They're there, in our understanding of the theories, they're there as tools and for our knowledge to better allow us to meet the client where they're at and assist that client and increasing that intrinsic motivation and moving forward. That's a nice summary of it. And they help us guide that process of self-discovery for the client. Maybe that's a little more succinct summary of the theories. But with that, the man that needs no introduction, bigger than Texas itself, Brian McSpadden, will take you through a very fun topic.
All right. How's everybody doing? That was a lot. Charlie, how much time we got? How much time do we have left? I guess that's more appropriate English.
Right, about an hour.
About an hour.
Yep.
You think we could let them do a couple of minutes of an intentional walk, a mindful walk, to get stretched out, and because we got more didactic learning, and they've just done a lot. So let's do about 3 minutes of mindful walking, and let's come back with what did you take away from that? What did you hear? What did you feel? And how you're using that for your well-being. Okay, so let's come back at 8:01 or 8:05. What's better?
8:01 is 4 minutes, 8:05 is 8 minutes. So let's go.
8:05. Well, I don't want part of that
8:05.
intent.
Eight-
I don't want that
8:05
part of that intentionality to be your restroom break.
8:05 is also, a good round number for us unmathematicians. You know what I mean?
Yeah. Yes. All right. 8:05 or whatever your time zone says.
5 after the hour.
Thank you.
Staying out of trouble, Brian?
No.
But are you at least keeping your trouble to your local level, your local facility?
That's pretty much, yeah.
Okay.
Within our section so far, our service, I guess, because we're part of Ho Health in the rec therapy world.
Recording is still on.
Oh, good call.
Why do we have two Chads? We don't need two Chads.
I took the iPad and took the dog for a walk, so I signed in again with the iPad.
Never have enough Chads.
Yes, you can.
Now I'm hanging out. Got the office in there and an iPad here. I'm just going to sit here and listen, watch and learn.
All right. Where do I request to take over? I had saw it earlier.
You just got to go down to the bottom, share the little green share screen.
Oh, there we go. Been a while.
Charlie's here, so I'm guessing Duke doesn't play till tomorrow night.
Yeah, they play tomorrow. I was actually looking up some scores a minute ago. I hope Alabama beats North Carolina.
Me too. Roll Tide.
Roll Tide. The only time I'll ever do it.
Ooh, it's been too long since I've done this. All right, everybody see my screen? Should say Whole Health Coaching using motivational interviewing skills. Okay, good. All right. Is everybody back? I can't see the rest of it, maybe. All right, oh, here we go. Okay. All right, how was the walk? I see some heads nodding.
Good.
What was good?
Just taking time for intentional movement was good. Been a long day and all good things, but still just like a moment to just be present.
A moment to be present. Did you notice any sounds?
Lots.
Were they, yeah, hopefully they were good sounds. I had a few. I'm in the country and I should take a picture of kind of surreal where I'm at, a lot of pastures and so a lot of birds smelling. We're raising hay right now for the cattle, so kind of a plush scenery out there. In August it'll all be burnt. So it's just a nice nice time of year for us. Anybody else?
Mine's a lot of kids. Kid noise.
Kid noise. Yeah. That can be fun sometimes. As long as they're not fussing. Yeah. All right. Well, thanks for participating in that. Hope you got a break. We got a little bit of time left. All right. What do we know about motivational interviewing?
I think that's where you try to focus on the client's strengths and what help pull those out of them, keep them in a positive mindset, support them to have a positive mindset.
Yeah, it's just another coaching tool. It's used in a lot of professions. This is the book. So we're gonna cover this in 40 minutes. So no pressure. So it's used in a lot of fields. So for those social workers out there, happy Social Work Month. It's used in psychology. It's used in coaching. It is a tool in your plethora of tools and skills that you've learned, and it's going to reinforce a lot of the things that you've already learned in the course. And that's why we can kind of go over it pretty quickly. You'll see the ties to what you've already learned. So it's by Milner and Rolnick. It's been around for at least 20 or 30, probably 40 years. The 4th edition just came out last year. And the only big change I was listening to on Audible, because I have an hour drive every day to work and back and forth. So I've just finished it. And so the kind of a difference in that, I'll talk a little bit later about the writing reflex. It's now called the fixing reflex. But everything else is pretty much in line. This is a big component of the health and wellness coaching content. Thankfully for Charlie for changing my slides that were just pinpoint, had a few little diagrams in there. So he made it a much more enjoyable slideshow. Taking that, as he said, my militaristic bullet points, and making them a little more viewable. And so we'll see. But a lot of the things that when I wrote this several years ago, or at least the beginning of it, it was very tied to the coaching content. So if you look in that coaching content manual, you'll be able to see some relatedness to it. All right. Does anybody read that for me?
People are generally better persuaded by the reasons which they have themselves discovered than by those which have come into the minds of others. There's Pascal.
Yeah, and he was a 17th century French mathematician, philosopher, and basically, when I don't know if you had the experience before, when someone tells you what to do, you're less likely to do it than when you come up with the idea yourself. And as coaches, our job is not to tell someone what to do. Our job is to help them with their coaching skills choose what they want to do, and they're going to be more apt to be successful in doing that. Give you a second to read. There's several definitions, more in depth as it goes down. It's collaborative. It's a conversation. And what we're trying to do is strengthen that person's own motivation and commitment to change. So motivational interviewing was developed several years ago to kind of work more with substance abuse and behavioral health issues, and trying to discover how to use these skills to deal with ambivalence when someone's not sure. And we think about the transcendental theory model, and they're probably in pre-contemplation or contemplation, and how to get them to move forward. So we're looking for different skills that we're going to use, and we're also looking and listening for the language that the coachee, the client, uses. It's goal-oriented style to help them achieve their personal motivation and commitment for their own reasons and using their strengths. Any thoughts or questions on what motivational interviewing is? It's a guiding style. It's a partnership. Coaching is a guiding style. And we are trying to avoid being directing, dealing with ambivalence. And we all are ambivalent about one thing or another. Are we like, should I eat that cheeseburger or should I eat that salad? And have some ambivalence into just different choices we make. Should we exercise? Should I take this medication? Should I stop smoking? Should I stop drinking? And where are the client is during those different changes? When a helper uses a directing style and argues for change with a person who is ambivalent, they're going to immediately oppose you. They're going to kind of come up with reasons why they do it. It's just our natural process of when we try to do, tell them what to do. That's when walls are put up, and we have stopped engaging in a collaborative coaching, guiding style, and we've become directive, and people put up walls on that. And as we can get using these skills, get them to say what they want to do, they're more likely to do what they chose to do. When you learned about brainstorming and provide elicit, generally people choose the things that they talked about and chose when they made their action steps or their goals. Give you a second. That's a busy slide, but it's a great slide that encompasses motivational interviewing. It talks about the spirit, partnership, collaboration, acceptance, compassion, evocation, the process of it, engaging, focusing, evoking, and planning. Using the MI skills of OR's open-ended questions, affirmations, reflections, summaries. Those should be very familiar with you in the coaching process. And then guiding principles, a road with resistance, which is fighting that fixing or writing reflex. Understand, listen, empower. And then listening for the change talk with desires, ability, reason, and need. And then getting commitment, activation, and what steps are they taking. So when they finally get to those action steps, they made the goal and they're making those change. So we're going to start with the spirit of MI. It is characterized by an attitude or approach to the clients to a behavioral change that is with a partnership. It's collaborative relationship. It's like dancing rather than wrestling. It's trying to get playing off each other's strengths. The coach, as Todd talked about earlier, the coach is the expert with the coaching skills and processes, and the person is the expert of themselves. They know what they will do, what hasn't worked, and we're trying to find out what will work. And we're part of that process and of that collaboration. And then acceptance. It's not the same as approval. Rather, it's that total positive regard of prizing their inherent worth and their potential. How do we help them see their potential? We know they can do these things. They may not believe it at this moment, but we have to hold that hope and accept them for who they are and for what they can do. We give them the autonomy and the respect and their freedom of choice to make that, and in an empathetic, listening way. We use compassion so that we pursue the welfare and best interest of our client. We're not sympathizing with them, we're empathizing with them for their personalization of their expertise. We want to walk with them in their shoes and in this journey. And then we're going to use evocation to the idea that the client has the inherent wisdom and strength and motivation to make these changes that they're wanting to do. It is our job to help draw them out sometimes instead of thinking, hey, you need to do this. We're trying to evoke what they can do based on their skill set and what they know. And using PACE as the spirit of motivational interviewing. So now going to the process of engaging, focusing, evoking, and planning. Any questions so far? Pretty straightforward. Trust and rapport. How do we create that calm, safe, judgment-free zone where they know they're not being judged and we are holding hope for them? We're allowing them to be able to focus, find that gap between the present situation and their values and goals. What's going on now? What's reality? And how do we tie that to their values and goals of what they want to do? And then by asking open-ended questions and reflecting, summarizing, we're going to invoke their reasons for change, their why, and then their why beneath their why. We can help them find their why without asking why. That usually puts people in a defensive mode. But we're really trying to find their why. What's their purpose? What's their mission, aspiration, and purpose? What's important to them? You know, why do they want to make this change? And what's really driving that need for change? And then how do we create that plan, that action plan, setting those SMART goals, setting those SMART action steps to help them be successful in their journey? So that's all ongoing and at the same time that we're using these skills. Looking at the guiding principles. So resist the writing reflex. How many people want to fix things? You're listening to that person talking, you're like, I got this fixed. I know what they need to do. Anybody struggle with that? Yeah. Before you learn all those other skills, I mean, it's really, you know, we don't listen well, and we catch enough of what we think they need to do, and then we go right in there and like, oh, here's all you got to do, and then we stop listening. So we really got to resist that writing or fixing reflex. Understand where they're at, who they are, and their why. Actively listening, and then using that to empower them to make those choices and make those decisions. So rolling with resistance. We're not wrestling with them, or wrestling, as we like to say in Texas. Make sure y'all are listening. There. Anybody wrestle when they was kids? You still might. So we're going to reflect what they're saying, and we're going to try to reframe it into a way that's going to help them grow and see themselves, the possibilities of what they're doing. Reinforce their personal control and choice. They have the choice to do this. We want to empower them to understand that and give them the autonomy of them being their best selves and choosing those directions. And we're, you know, when they get a little stuck, We're going to come alongside them and just remind them of what their values are, what their strengths are, and their why. Sometimes they get so bogged down into the embellishments of it, they forget their why and what they're doing. So no wrestling. MI skills. This should look very familiar. All right. Have we learned enough about open-ended questions? Affirmations, reflective listening, summaries. And some of those initial skills that you're using. That's why this tool works really well in the coaching field. Because this is what we do as coaches. We ask those open-ended questions. We reflect back. We're actively listening. And then what affirmations and acknowledgments. What's the difference between an affirmation and cheerleading, encouraging, supporting, or celebrating? What are we trying to do with affirmations?
Basically, I'm thinking affirmation is you trying to encourage their strength, their ability, and just affirm them that they have this innate strength to achieve what they set out to do, and not just say, oh, fantastic, great, excellent. I mean, that is cheerleading. That is different from affirmation.
Right. So we're trying to tie their value or their strength or what they hold important to their accomplishment and affirm them in their action that they did. And we're not saying great job, because then we're putting our own bias into it, because then they're going to be looking for us to say great job on everything. And if we don't say that, then it's like, what did I do wrong? But if we can if in our listening and learning who they are and learning what their strengths and their values are, and they achieve those things or they make progress, because we want to acknowledge they may not have achieved it, but if they made progress, let's affirm that progress that they're made, their intention, their good steps, their strengths, and their efforts in a positive way, and using that positive psychology that Todd taught us about earlier. And then using those summaries, reflecting back, helping them have a snippet, bottom line up front, being succinct, giving them a little bit of back of what you heard to them, so that they can hear that again. Any questions on oars? I didn't know y'all were rowing a boat, did you? You're not as good as Todd on his jokes there. All right. EPE, illicit, provide illicit. What have you learned about it? You've learned this EPE previously?
You did.
You did. Okay. What was the challenge of EPE?
You have to be careful how you offer information. So you do it in bite size. You also make sure that you get their buy-in before giving them the information, and just be careful how those information is being shared.
Yeah, you they're stuck at a point where they may need more education. So if you have that, you know, we're going to ask permission. Hey, I know a little bit about that. Would you like to hear what I know about? And then hopefully they say yes. If they say no, then don't. Rarely do they say no. But then you're going to provide just enough information to give them a decision point, and then ask them again, you know, will you use that going forward? And it may trigger something else they know. It, you know, it may give them a unstuck point, but it gets them provided to a recommendation that you're not giving advice. You're giving them an option to choose. So it's also known as ask, tell, ask. So looping that information back into what they're trying to do, the goal or step they're trying to accomplish. So, and remember, it's EPPE, and it just keeps on going until they have the information that they need to make that decision. And they may not choose to, they may not help them at all, but at least you've shared, you've asked permission, and you give them the autonomy to make that choice based on the information that you shared, whether that's around the diagnosis or prescription, but make sure you're staying within your lane on that information that you're sharing. Or let them know, hey, if you're a social worker or a doctor, hey, I know this based on this, this skill set I have, or I've read this, or I've experienced this. All right, going to change talk. This is where we really have to be listening. We're listening for their desires of I want, I wish, and then their ability, I can, and reasons for what they're trying to do. If I can, then I can. Or their needs. Hey, I have to do this. I should do this. What's important about listening for these different categories in change talk?
Tells you how confident they are about their abilities and where their mindset is.
It kind of helps you know, yeah, exactly. Their confidence, if they're ambivalent, they're wanting to make change, or maybe they're not quite there based on, I want, I wish, I can. And then, then how do we move that and listen to them to get them to make those different steps? So we can kind of see where they are in their in the theory of change. And you're also listening for ambivalence in that gap of change talk of what they think they want, and then in the same breath they'll give you the reason why they can't do it. So it's a stuck point. It's a good place to just kind of sit and listen, reflect back, double-sided reflection. Hey, on one hand, I hear that you're really struggling with eating cheesecake, but on the other hand, you're really wanting to reduce your sugar content. And where are we at on that? And help them, guide them through that, and not making them feel judged, but just acknowledging, reflecting it back, and giving and helping to identify that gap so they can maybe hopefully see that for themselves that they may not see, so that they can make those decisions and hear those contradictions that they're having in their own choices. And then last, CAT. Commitment, activation, and taking steps. What stage is this in whole health coaching, of the different stages that the 4 stages? What does this sound like?
The action stage, it took action.
Yeah. When you think about stage 3, in stage 4 of the coaching process. You know, we're making those actions and they're taking those steps, and then we're rediscovering what went well and what could go better, and then any changes that they need to make. So getting that commitment, getting that, you know, how important, that's important scale on 1 to 10, how important is this to you? And then once we get that action step and they're committed to that on a scale of 1 to 10, how confident are you? In discussing, you know, gauging that. And if they're above a 7, what's that tell you? When we ask a confidence ruler or a motivational ruler, and they say they identify they're a 7 on either one of those, what does that let you know?
They're confident enough that they can actually make a change.
Yeah, they're on the far side of, hey, they're making that change. So then we kind of want to help them, like, so what does that 7 mean? And then what would it take to go from a 7 to a 9? And so maybe elicit some more change talk into getting them to be further emboldened to make that decision, to be motivated in the importance of it and the confidence in actually doing it. So a 7's a really good marker, but we still have some work to do to get them to where they're fully engaged. But they are, you know, they're ready to make action and they're ready to do things. So we want to guide and assist and partner with them to identify those extra things they may need to do to get that to be more motivated, more confident in what they're doing. All right. We went through that fairly quickly. What are your thoughts or your questions about how motivational interviewing relates to health coaching? Well, I guess, does it relate to health coaching?
It seems like it's kind of a basic framework of health coaching because you have a lot of the things, open-ended questions, affirmations, reflections, summaries. It kind of sums up what the things that you want to do in health coaching to get the client where they want to go.
Yeah, it's basically encompasses every one of the skills that you've learned so far, and it's just a way to kind of wrap it up and use it to further help the clients make those decisions and make those action steps to be successful. And just realize, we talked about relapse earlier. Relapse is similar to ambivalence. Sometimes they may not make those choices because they kind of unsure about it. So they're stuck, or they fall back and they're like, that's not a big deal. So if we can catch them, help them identify that ambivalence, and then dig deeper and help motivate them, help encourage them, and collaborate with them to get them back into that intrinsic motivation and guide them to where they can be successful. And I like that. Evokes what is already present. We're not telling them what to do. They've already been describing it. We're just partnering with them and mirroring it for them. All right. And your favorite slide for the night? Because it's the last one I have. What questions do you have for the night? A lot of information.
I have a question. I am sitting here and I'm thinking, sometimes you might have a client who is so ambivalent that they just don't move past that situation. You're trying to motivate, you're trying to make them see their strength and, energy, positive stuff that they could do. How do you handle such a situation?
You're having a client that's pretty much stuck in and doesn't make decisions to move forward or doesn't make actions to move forward. Well, we got to go back and dig deeper in their why, in their reality, and see what obstacles that they may be encountering, and getting back to the basics of, their motivation, their strengths, and digging a little bit deeper into that reality or those obstacles that's keeping them from being successful. Anybody else have a recommendation or thoughts on that?
It's just that as Brian was saying, you got to meet them where they're at and stay with them where they're at. And with coaching being that guiding style, just because someone's pre-contemplation doesn't mean they can't be coached. It just means maybe we have to spend a little more time with that vision, establishing those values until they're ready to move forward. We got some invoking questions that we can ask around that stage. Like, what would an older, wiser self say about this? If we listen and we're using other focused listenings, oftentimes we're able to identify other people in their life that are important to them. What would your mother want you to do? Is an invoking question, because coaching is a lot about planting those seeds. And what we're doing with this and this style in our open-ended questions and that deeper inquiry and even our reflections is we're planting those seeds.
And you may have heard this analogy before, planting the seeds. So sometimes, you're digging the hole, and then sometimes you're putting a seed in there. Sometimes you're covering it up. Sometimes you're watering it, and then sometimes you get to see it grow. So being your best self in that moment and partnering up with them and meeting them where they're at, as Todd said, is the best thing that we can do as coaches to help them be the best that they can be and rise to their potential. And hopefully with our positive support, they can make those changes. But we don't, sometimes it takes a while to make those changes.
And one of the things too, we talked about that strength-based approach and a few different theories earlier today. And one of the things you got to recognize is that client, maybe they're in pre-contemplation about something, but they took an action step. Even that action step was seeking out a coach. So some of that intrinsic motivation is already there. And it's we as coaches that are going to help build upon that and expand upon that. And, the other thing too, we're mentoring everybody through this course is when you get there and you're out in practice and private practice, I strongly encourage everybody to seek out some consultation with other people. So when you do encounter things, there is somebody that, you're able to specifically lay down some things and somebody can, help guide you through a process and maybe offer you some other techniques for those specific instances. Because what we give you right now are kind of generalizations.
And I will say for future, this is when you set for the exam, this is all in it. So this information that you received tonight is very helpful for when you sit for the exam to be successful. All right, that's all I have, Charlie. Ted Lasso.
All right.
Nope.
Charlie, anything you want to add?
No, I was going to say then we're done for tonight unless anybody has any questions about anything going on with the course or anything.
What's the over under on the Duke game for total points?
I have no idea. I typically never look, but I'd say we'll
Duke's,
see.
yeah.
Is it basketball season or something?
Here's Brian. All right. Well, thank you, everybody. If y'all do have any questions, feel free to reach out. Otherwise, we'll see y'all next week.
All right. Thank you.
You.
Bye, everyone.
Bye.
Have a good weekend.
Go to bed, Sade. Get you some
That's right,
rest.
I will right away. Bye.
Right away.
Right away.
Nope.
Oh, let me stop recording.